Okay, so let's talk about something that can be pretty stressful but is totally fixable: surprise medical bills. Yeah, we've all heard the horror stories, but today we're going to arm you with a super simple playbook to make sure your next procedure doesn't end with a nasty financial shock.
And it usually starts just like this, right? You're all set for a routine procedure, maybe just an injection. You figure you know the drill. And then that estimate lands in your inbox and bam, your heart just about leaps out of your chest.
So what in the world is going on? How does one simple procedure end up with two completely different price tags? Well, that's the big mystery we're going to solve together. And trust me, the answer is usually hiding in plain sight.
Now, just look at the scale of this difference. I mean, we are not talking about a few extra bucks here. This chart shows that the exact same procedure with the very same doctor can cost 2, 3, sometimes even 4 times more, all depending on where it happens. It's wild.
And here it is. This is the big reveal. The reason for that huge price jump, it's not because the medicine got better or the needle got fancier. Nope, it's the building itself. You're not paying for a better procedure, you're accidentally paying rent on a much more expensive room.
So let's put a name to the villain. It's called the facility fee. The best way to think about it is like a cover charge for the place. It pays for all the overhead, the staff, the high-tech gear, the paperwork, all the stuff that's totally separate from what your doctor is actually doing for you. And that's the key thing to get. Your bill is often sliced right in two. This slide breaks it down perfectly. You've got the professional fee, which pays for your doctor's expertise, their hands and their brain, and then you have the facility fee, which pays for everything else: the building, the support staff, the whole shebang.
Okay, so the big question is, how do you avoid paying for the real estate? Well, let's put on our detective hats. We're going to figure out how to spot these fees before you even walk in the door.
It all comes down to the setting. Think of the location as the price tag. This table shows your 3 main options. A private doctor's office, you're unlikely to see a facility fee there. That's your best bet for routine stuff. A hospital outpatient department, that's where these fees are super common, and it's usually for more complex cases. Then, somewhere in the middle, you have surgery centers, which can be a good middle ground option.
Seriously, if you remember just one thing from all of this, let it be this. The single word that is the biggest clue, the biggest predictor of a facility fee, is the word department. If you see that on any paperwork, alarms should be going off.
And it's not just department. If you see any of these other phrases, treat them like red flags. It doesn't mean a huge bill is a sure thing, but it's a major sign that you need to stop and ask a few questions.
And here is your magic wand. Don't be timid about this. The absolute fastest way to get a straight answer is to ask this exact question. Being this direct forces them to give you a clear yes or no, and it could literally save you hundreds, maybe even thousands of dollars.
And now for the best part, your action plan. This is how you go from just being a detective to being the one in control of your healthcare costs. We're talking scripts that get you actual numbers, not just vague feelings.
See, just asking, how much will this cost, isn't enough. It's too vague. You have to be super specific, and that means following these 3 steps. Get it in writing, make sure they break out both fees, and get confirmation on the location type.
And hey, we've even made it easy for you. You can literally copy and paste this script right into your patient portal. Asking for the CPT code, that's just the specific billing code for the procedure. Make sure you're all on the same page. This is a polite but really firm way to get everything you need, and it creates a written time-stamped record.
Okay, listen up, because this is a huge one. This is where so many people get burned. You do your homework, you check that your doctor is in-network, and you think you're golden. But the facility itself can be on a totally different insurance contract. In-network is not one checkbox, my friends, it's 2. So when you do call your insurance company, you've got to use this precise language. You have to ask specifically about the facility, not just the doctor. And then you ask about how your out-of-pocket costs change depending on the location. That's how you get the real financial picture.
Let's be real, most surprise bills happen because we're in a hurry, right? You just want to get it done, so you grab the first appointment available. But just slowing down for 90 seconds to check the location and fire off that estimate request can save you from these really common and really expensive mistakes.
Whew, okay, we've covered a ton of ground. So let's boil it all down into one clear, simple strategy you can start using, like right now. And this slide just sums it up perfectly. In a doctor's office, you're usually looking at one main fee for the doctor's work. But move that same procedures to a hospital outpatient setting, and that one cost splits into 2 separate bills, one for the doctor and one for the building. So it all comes down to this simple 3-part strategy.
This is your entire defense plan. Ask for that two-part estimate, confirm the location in writing, and then verify that both the doctor and the building are in your insurance network. That's it. That's the whole game.
So this isn't just a bunch of information, it's a tool that's ready for you to use. Every single appointment you schedule is a chance to put this playbook into action. So the real question is, what's the one message you can copy from this explainer right now to take control and protect your wallet?